know that in order to handle delegation questions on the NCLEX effectively, it's not about memorizing definitions, but about showing that you can make safe clinical decisions. These decisions depend on three key factors: the professional role of each nursing team member, the patient's condition, and the level of judgment required. So in these sections, let's walk through three clinical cases. Each one will test your judgment and at the same time help you gain confidence when answering these types of questions on the exam. Let's start with the first case. A registered nurse is supervising a nursing assistant. Which of the following tasks is safe to delegate? A. Measure blood pressure in a stable patient. B. Teach deep breathing exercises to a postoperative patient. C. Assess the patient's response to pain medication. And D. Administer subcutaneous heparin. The correct answer is A. Measuring blood pressure in a stable patient. Why? Because vital signs in stable patients fall within the UAP's scopes of practice. On the other hand, options A and B involve patient education or clinical judgment, which are the RN's responsibility. And option D involves medication administration, which also cannot be delegated to a UAP. Now, moving on the second case, which of the following tasks can an RN safely delegate to an LPN or LVN? A. Administer an IV bolus of morphine to a patient with severe pain. B. Perform a neurological assessment to a patient with recent head trauma. C. Administer oral antibiotics to a stable patient with pneumonia. And D. Teach self-care to a newly diagnosed diabetic patient. The correct answer is C. Administering oral antibiotics to a stable patient with pneumonia. Here's why. The LPNs are trained to give oral medications and provide care for stable patients. However, administering an IV bolus, performing a specialized assessment, or providing initial patient education all require the RN's judgment and scope of practice. Finally, let's look at the third case. A UAP reports that an 84-year-old patient feels weak while trying to walk to the bathroom. What should the RN do? A. Ask the UAP to assist the patient using a gait belt. B. Delegate the assessment to the LPN on duty. C. Ask a family member to accompany the patient. And D. Personally assess the patient before allowing further ambulation. The best answer here is D. Personally assess the patient before allowing further ambulation. Why? Because this situation indicates a possible change in the patient's condition. Only the RN has the preparation to assess and make safe clinical decisions. Delegating in this scenario will be a serious error since it increases the risk of falls or injury. Before we close, let me share with you 5 key recommendations to master delegation questions on the NCLEX. First, make sure you understand the legal scope of practice for each nursing rule. Second, never confuse basic tasks with clinical interventions. Many simple-looking tasks actually require judgment. Third, always identify whether the patient is stable or unstable. This is a critical dividing line. Fourth, don't let words like routine or easy trick you. Even simple tasks may still require assessment. And finally, when in doubt, always prioritize patient safety. Choose the option that prevents errors, avoids omissions, and ensures safe patient-centered care. If you found this information helpful, I encourage you to keep learning with us. On our social media platforms, we share short and dynamic lessons, simulated clinical cases, study tips, and exclusive strategies to prepare for the NCLEX. So make sure to follow us on Facebook, Instagram, TikTok, and YouTube as Enfermeras en USA and NCLEX con Enfermeras en USA. And before you go, don't forget, save these tips, share them with your college, and join our community of nurses committed to practicing in the United States. Success on the NCLEX is absolutely possible, and you got what it takes to achieve.